guys don't want you don't want plantain? We forgot. Who's going to plantain?
Hi everyone, damn bad. You're welcome. Niger Beats, you're welcome. Mm. Good evening, as Asha Young. How are you? Um, the fertility conversations. Good evening. How are you? You're welcome. Um, Onome Ati Perez Shop Online. You are welcome. It's nice to have you guys. Afolabi Blessing. 8165 Linda. You're welcome. Um, Dunamis, you are welcome. I just want to give people chance to join before I start. How was our day today? I hope today has been a great day. Can you guys hear me? If you can hear me, please let me know. Can you hear me? Can you guys hear me? Please let somebody respond. I'm not getting any feedback. On Facebook, can you hear me? On Instagram, can you hear me? All right, Dunamis. Can you hear me? Yeah, it's been great. Okay. All right. Okay. So you can hear me. All right. That's good. That's good. That's good. Lade, you are welcome. On Facebook, can you hear me? I'm trying to go both on Facebook and Instagram at the same time. But I don't know if they can hear me on Facebook. Can you hear me on Facebook? Facebook people are not responding. Facebook, can you hear me? All right. Otusanya, you are welcome. All right. Thank you, Dunamis. I'm audible. All right. It's Facebook people that have not been responding. Can the people on Facebook hear me? Please let me know if you can hear me on Facebook. Dr. Val, nice to have you here. How are you? Hester, you are welcome. All right, thank you. Sandra, thank you. You can hear me, all right? Okay. All right. So it's nice to have you guys here. I hope our day went on fine. Doing Sola, Tolulokpe, Bimbola, you are welcome. Um, I don't know. I'm trying to see if I can give people a little bit of time to see if to see when we can start. I want people to come in more. All right. So today we want to look at why you could be having difficulty with getting pregnant, and I I feel there is a need for me to talk about this issue, and so that people can understand that there are reasons why you can be having issues with conception. And that was why I decided to come online to come live and talk about this, so that we can start having an idea of where the problems can be, what you can do, what are the things that can be causing the problems, what are the things that you can do to solve the problem. And from there, we know how to take it and how to go from there. Um, my healthful mind, or light Tonwi, you're welcome. BSC Clothings, you're welcome. All right, so let me just do a little bit of introduction about myself. I'm Dr. Adelekun Olusheyi, also known as Dr. Sheyi. I have been in this field of gynecology for more than 12 years. I'm a gynecologist, I'm a consultant, obstetrician, and gynecologist. And I've seen a lot of people over my years of experience. I've seen a lot of couples trying to conceive. I've seen pregnant women, I've seen them go through a lot of issues. And one fundamental issue I've found out about the main problem is that people don't have the idea, they don't have informations. And I feel that giving information is very, very key to people. If you have information about problems, your problems are half solved. And so, but if you don't know where the problem is, you don't know what the problem is, that means you have a long way to still go. But if you know where the problems are, then that means your problems are halfway gone. So I decided to come online, to start Instagram page and Facebook page. That was about 3 years ago in 2018. And I have tried as much as possible to put a lot of information out. I've talked about how you can get pregnant, problems with getting pregnant. I've talked about when you get pregnant, what are the things you need to do to make sure that your pregnancy is safe, that you have a live baby, you have a good baby at the end of the day. Tolulope Olayera, nice to see you. You're welcome. All right, so I found out that giving information to people will solve a lot of problems. If you give people information, it will solve a whole lot of problems. So that's why I've done everything as much as I can to talk to people online, to do daily posts. I have free videos. You can check my website www.askdrsheyi.com. You will see some videos. You can check my bio in Instagram. You'll see some videos. You can go to YouTube. I have videos on YouTube. Ask Dr. Sheyi on YouTube. I have some videos there. You can watch the video and have better understanding. I have also podcasts. You can check it out on podcasts. TTC Pregnancy and Dr. Sheyi on podcast. So you will have a whole lot of information about problems that people can be facing. either while trying to conceive or while pregnant, and what they need to do. So that was why I started these online pages, Instagram and Facebook, so that I can help a lot of people get information wherever you are. The world is not a global village. You can hear, you can talk to people, you can have information from anywhere you are. So that's just the little bit about me. So today we are going to look at why you may be having difficulty with getting pregnant. Um, over these few years, I've had a lot of couples that I've been able to talk with online and physically, and I found out that a lot of people they don't even know what their problems are, and then if you don't know what your problems are, then you have a long way to go. So I now looked at it. So okay, what are do these people even really know what their problems are? When do you say that you are having problems with conception? When do you start getting worried about you conceiving? um what are the problems that can arise that you can say, okay, this is where my problems are, or that is where my problem is? Why are you having such problems? Then we look at, okay, what can you do about these problems, and we round off. So before you can say you have an issue with getting pregnant, you must have been having regular sexual intercourse for a period of a year. If you are less than 35 years, that means 34 years and below, you must have regular sexual intercourse. What I mean by regular sexual intercourse is that um you have you have a day, you leave a day in between the days you have sexual intercourse. It's very, very important, because I found out that a lot of couples, they are not having regular sexual intercourse. I will talk to couples online, they will tell me that they're having sex once in a week, some people say twice a month, and they are trying to conceive. There is no way you will be able to conceive except by luck, by which you conceive if you're having sex once a week, thrice a month, even twice a week. You may have problem with getting pregnant. It's going to be a hell lot of problems. So for you to say you are having issues, you must have had sexual intercourse every other day, Monday, Wednesday, Friday, like that. You leave a day in between, and you must have done that for 1 year if you are less than 35 years. But if you are 35 years and above, you must have done that for at least 6 months before you can say, okay, I think I have an issue with conception. So a lot of people have not even had that kind of opportunity, or that kind of sexual intercourse before they start getting concerned. You see that some people for 3 years they have been trying to conceive, and when you ask them, they may not even have sex in a month. They may have sex twice or thrice in a month, and you are trying to conceive. That means you are just wasting your time. Sexual intercourse is the um, fundamental level when you are trying to conceive. If you don't have regular sexual intercourse, you cannot get pregnant. And that's the truth, except by luck and chance. If by chance, maybe fortunately for you, on your ovulation day, that was one of the days you just had sex, and thank God everything just went fine. So these are very, very important. So if you are less than 34 years, before you start having issues, before you start becoming agitated, look at how your sexual life has been. If you are 35 years and above, look at what you have done for 6 months, and then you can now say, all right, this is where the problems are. However, if you have fertility related issues, maybe you have menstrual irregularities, you have some bad abnormal vaginal discharge, you have other problems that you feel that, these kind of problems are not the kind of problems you wait for a period of 6 months or 1 year. You need to start getting concerned. In fact, even before you get married, if you have menstrual irregularities, what I mean by menstrual, anything beyond your normal menstrual cycle should be between 21 to 35 days. So if you have anything outside 21 to 35 days, 21 to 35 days means that from the first day of your cycle to the day before the next day of your cycle, the last day of that cycle. You see your cycle, let's say you start menstruating on the 1st, and you are seeing your next menses on the 29th. That means your cycle is between 1st and 28th. So that is your cycle. And as long as it is between 21 to 35 days, that means that you are fine. But anything outside that range, you can have 28 days this month, you can have 25 days next month, you can have 32 days months after the next. But as long as it is within that range, that means that your cycle is normal. Because a lot of people, they will tell me their cycle is irregular, and they usually have a cycle between 21 to 35 days. So once you have anything between 21 and 35 days, your cycle is fine. We just need to look at, okay, what are the other problems you're having? Because there are other things. We will talk about it as we go in this live program. So now, like I've said, before you can say you have problem, you must have been together or have sex regularly for 1 year, less than 35 years, and 35 years and above, 6 months. So why can you be having, or what can be the cause of having the difficulty? What can be the cause of having problems with conception? And I'm going to break it into two. It could be problem with the man, or it could be problem with the woman. And I'm going to start with the men, because I found out that male factor infertility is really high, but people are not taking note of it. Men just feel, I'm fine, I can't be the problem. But I've found out that a lot of men are actually having serious problems, and they don't even know that they're having problems. And so they will put the pressure on the woman. A lot of women are under pressures. I've seen women that have spent so much trying to sort themselves out, only for us to find out after a year or two that the woman has spent so much on herself, running from one pillar to post. And let's do the husband sperm test now. Find out that the husband sperm is very, very bad. And there was no way the woman will have gotten pregnant, even if you do everything you want to do about it. And so I feel men should start taking note of the problems. And what are those things that can have, what are the reasons why men can have difficulty with impregnating a woman? It could be problem with production of sperms, or problem with transportation of sperms. The sperms are produced in the testes. The testis is inside the scrotum, outside. When you at least we know how the scrotum and the penis looks like. So the sperms are produced inside the scrotum, inside the testis. Now there is a reason why that testis is located outside the body, because it has to do that. There has to be temperature regulation around the testis. For testis to produce sperm optimally, the temperature must be optimal. And that is when you notice during harmattan period, during the cold season, you find out that the testis is closer to the body. You see that the scrotum everything is closer to the body. And during the heat period, it looks a bit far from the body. It dangles down from the body. That means that during the heat period, the temperature is high, and the body is moving it away from the body. It's moving it away from the core body temperature so that it won't affect the production of sperm. While during the harmattan or cold period, it moves it to the body so that it can get temperature from the body, can get warmth from the body. So that is why it is like that. So anything that produces high heat will affect sperm production. Anything that you are doing that is eating up the testis will affect sperm production. If you are wearing tight pants, nylon pants, there are some men that wear nylon pants. If you wear nylon pants, it's going to increase the heat. If you are obese, there are men that are big, and then if they are standing, you see that their thighs are you can't even see any slit, any space between their thighs. It's just close together. That means the body is wrapped around the testes, And in such instance, the heat coming on the scrotum, on the testes is high. So in such people, they may have problem with sperm production. If you are taking alcohol and you are smoking, you can have problem with sperm production. In fact, if you are not smoking and you are moving with smokers, you are always around smokers, you are a secondary smoker. Secondary smokers get more of the chemicals compared to primary smokers. So you are even at higher risk compared to other men that are actually smoking. So a lot of people, they feel that I'm not smoking, but they are around smokers. They move with smokers. You are always around them, and you are taking it in. And if you have sperm problems, that means you need to get away from that. If you are trying to conceive, you need to get away from such environment. You need to stop drinking alcohol. Then some people, they take hard drugs, cocaine, marijuana. Some people take steroids. All these drugs, they have effect on sperm production. Then if you have what we call testicular torsion, now this happens more in younger men. You just find out that your testes, your scrotum becomes swollen and it's painful. A lot of people, they will go to chemist or go to a pharmacy. They will tell them, I'm having pain, my scrotum is swollen. They will just give them maybe pain relief, give them antibiotics, and that's all. But what happened was that there is a stalk, there's something we call stalk, spermatic cord, that is from the testes. It takes it into the body. Now that spermatic cord, it can twist. Sometimes it can twist when the testis twist on itself. Once it twists, that means that the blood vessels that comes to the testis will be blocked. And when it is blocked, you have pain, you have inflammation. That's why you see the swelling, and there will be pains. So in such instance, the best thing to have done was to go to the hospital within 6 hours of seeing that. But a lot of people, by the time you use antibiotics, you use pain relief, you get relief from the pain, the testes will not get blood supply eventually, and it will die. And such people, once it dies, that's the end of that testis. That person can never produce testes. Can never produce sperm again. And unfortunately, if it affects one testis, later it may affect the second testis. So in such instance, you have people that they've had that while they were younger. And when you look at their testes, it's already small. It's not like the adult testes. You just see something small inside the scrotal sac. So in such, those people will have had that kind of problem when they were younger. We have had few examples like that. So if you have, apart from smoking, and they have talked about hard drugs and all those things, those are major. Then sexually transmitted infection, sexually transmitted infections has a way of destroying the sperm. The testes and the sperm. So that is the problem with sperm production. Alcohol, drugs. Then if you have medical problems like diabetes, and you are not taking adequate care of it, it can kill the testes. So these are important things men need to note, that you have to look at all these things. Are you having any of this issue? Are you doing any of these things? If you are doing any, that means you need to take note of it. It is very, very important. Now, for sperm transportation, that means during sexual intercourse, the man deposits sperm inside the vagina during sexual intercourse. Now, there are some things that can affect that process. Any pipe that is blocked, it's just like when water is going through the pipe. When water is going through the pipe, and water is going from that place and going to another place, if the pipe is closed, there is no way water will move from that place and we get to where it's going. It's the same way with the pipe. It's the same way with the what do you call it now? The sperm and the tube. There's a tube or a pipe that comes from the testes that gets out. So anything that blocks that pipe is going to affect transportation of sperm. Sexually transmitted infection is one of them. A lot of people, when they were younger, they have gonorrhea, they have chlamydial infection, they have syphilis, they had a lot of sexually transmitted infection. And this transmitted infection will affect the pipe. It will destroy them. It destroy the sperm, it destroy the testes, and it can also, they will have pus. You have people getting pus coming out from their penis, and they don't get treated well. That pus, it will solidify and block that pipe. And once it blocks it, that person may not be able to get pregnant naturally again. You have to find a way, either we work on it or something, to find a way to get the sperms out and use it for IVF when helping such people. So sexually transmitted infection is very, very important. Some people have erectile dysfunction. When you have erectile dysfunction, you may not be able to achieve erection, or you may not even be able to ejaculate. Once you cannot ejaculate when you're having sexual intercourse, that means there is no way you are going to deposit the sperm inside the woman. So such can affect, those are the major two reasons why men can be the problem with conception. Now, people talk to me about when they have sex, there is a sperm. When the man deposits the sperm after sexual intercourse, there is sperm leakage. Now, I've always said it, I've said it a lot of times, that sperm leakage is normal. It's just like when you pour water inside a bucket and you now invert it, definitely water will come out. The water will come out. And are you guys hearing me? Are you following me? Are you following me? Hello? So that I won't just be talking for. Are you following me on Facebook? Are you following me on Instagram? Please let me know, because I've been talking for about 10 minutes now, or more than that. Are you following me? Please let me know. All right, thank you. What about Facebook? Are you following me? Are you hearing me? All right, thank you. Facebook people, they have not responded. Hello, Facebook people, are you following me? All right. I hope they will respond with time. Okay, so when you talk about when you talk about spam, okay, thank you. I can okay, thank you, Doinsola, thank you. All right, so when you talk about thank you, Tolulope, thank you. All right, so when you talk about sperm leakage, it is normal for sperm to leak after sexual intercourse. It is very, 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 very normal. Because if you pour water inside a bucket, the vagina is just like a bucket, and you invert the bucket, definitely, thank you, definitely, there will be movement of water outside. So thank you, Sandra. So there will be movement of water outside. That means that if a woman has sexual intercourse now and she stands up, that means there is no way sperm will not come out. Sperm contains water and it contains cells. Now, the most important things are those cells inside the sperm. Now, that is why when we check the sperm of a man, when we check we do some tests on the sperm to check the sperms. The cells are the most important, because once a man deposits the sperm or the semen inside the vagina, within 30 minutes, most of those cells are already going towards the tube where they are going to fertilize or meet the egg. So a lot of men, they have problem with movement of those sperm cells. Either that their sperm cells are not enough, they are not adequate enough, or that their sperm cells are not moving enough. A lot of sperm cells, they're just like snail or tortoise. And there are some sperm cells that are like cheetah. Yeah, cheetah. Cheetah is the fastest animal. There are some sperm cells that are like cheetah. Now, if your sperm cells are more like snails, that means that there is no way you will be able to impregnate a woman, because the egg lasts about 24 hours after release. And if your sperm cells are so slow that it takes more than 24 hours to get to where the eggs are, that means that there is no way you'll be able to impregnate a woman. It's not possible, except you do other procedures for you to be able to get pregnant. So these are important things. It's not about the sperm leakage. There is definitely going to be sperm leakage when you have sexual intercourse. The most important thing are those cells. Are those cells moving? Excuse me. Are those cells moving? Are they normal? A lot of men are having dead sperms. Are they alive? There are a lot of dead sperms that men are carrying. You can see a man, you have 50 million sperms, and 45 million are dead. Only 5 million are alive. 5 million is too small to be able to achieve conception, except through interventional means. Naturally, it is not likely going to be possible. So these are important things we need to know. So that's why I'm talking to men. I've found out that a lot of men they are not even looking at themselves. They will just be giving the woman a lot of pressure that it's the woman that has the problem. Why majorly it's them? So please, as much as possible, it takes two to make a baby. So the problem can be can be male oriented, or it can be female oriented, or it can even be both. And there are sometimes it is not even explained. There are sometimes you cannot explain why couples are not conceiving. So men, like I'm saying, and I will always say it, whenever you are having issues with conception, please, as much as possible, you are not the only it is not only the woman that may have problem. You may be the problem in the issue with conception. It may be you that you are having problems with your sperm. Please, as much as possible, when you are trying to conceive, it is not only the woman that should go out. It's not only the one that should seek for assistance or treatment. The men should also go for tests. The fact that you have even been able to impregnate a woman 1 year, 2 years ago doesn't mean that you cannot have problem afterwards. It doesn't mean, because you can have sexually transmitted infection, you can have any problem afterwards. Anything can have happened. You can develop any medical issue that can affect sperm. That could be anything. So the fact that you have impregnated a woman before doesn't mean that you are fine. You must always check. It could be at that time you impregnated the woman, everything was fine, but afterwards everything just went haywire. So that is very, very important. So now it could be problem with the woman. And when we are looking at problem with the woman, we look at, okay, it could be problem with ovulation. It could be problem with the tube. It could be blocked tube. It could be problem with the womb itself. So these are things that we can break it into. So if it's problem with ovulation, that means that you are not growing the eggs, or you are not releasing it. Now, if you have problem with growth of eggs, that means you are not ovulating. You are not growing, and you are not releasing. Ovulation is release of egg. So you may be growing the egg, and the egg may not be getting to the point by where it will be released. Or you can get to a point where it will be released, or it may not be released. So there are a lot of issues that can cause this. One, if you have things like polycystic ovarian syndrome. Polycystic ovarian syndrome, I found out that it's very, very common in our environment. Initially, I thought it wasn't that common. I thought it is more in advanced country because of their body size. We have more obese people and all those things. But now our environment is getting westernized, so we are having more obese people now. Though it is not only obese people that have polycystic ovarian, but about 70 to 80% of them are associated with obesity. So polycystic ovarian syndrome can be a cause of you having problem with ovulation. You can have problem with prolactin. Prolactin is a hormone that produces breast milk. And if you are not pregnant and you are secreting breast milk, you are having difficulty with conception and you are secreting breast milk, it may be the problem. And it may not be. There are a lot of that. At least about 50% of women, 50 to 60% of women that are having that issue are having regular menses, regular cycle, and they are ovulating. So it doesn't mean that it is the problem, but it may be the problem. Then if you have thyroid issues, hyperthyroidism, hypothyroidism, all these things can affect you being able to ovulate. So there are a whole lot of problems. Then your age, the higher you age, people that are 35 years and above, the higher you get, the lower the chances of having good eggs the lower it gets, and the lower your ability to ovulate. So by the time you are getting to 45, 40, the chances also reduces. They reduce. Then if you are taking alcohol, you are smoking, and if you are even around smokers, it's not only men, it's also women that you are always around smokers. You are affecting your ability to grow egg and ovulate it. It can affect it too. All these little things go a long way to affect your ability to conceive. So it's very important. So when you are talking of ovulation, these are major problems that can affect ovulation. Endometriosis can also affect ovulation. There are women that are dealing with endometriosis, especially if this is located on the ovary. It can affect your ability to ovulate. So endometriosis is one of the problems. Now, let's look at the tubal problems. There are tubal issues. Now, the fallopian tube is where the egg and the sperm meet for conception. That is where they meet. Now, if the tubes are blocked, that means the sperm will not be able to get to where the eggs are. The eggs can be released, but there is no way, because it's just the connection between them has already been blocked. So naturally, that means that it is not likely possible naturally to achieve conception when you are dealing with when you have blocked tubes. And what are the things that can cause blocked tubes? If you have sexually transmitted infection that was not well treated, a lot of women, they will have sexually transmitted infection. Some of them will have pelvic inflammatory diseases. It's not the kind of pelvic inflammatory disease that they tell you on scan. I'm not talking about PID on scan. The PID is not diagnosed by scan majorly. It's not even diagnosed by, there are criteria before you can say someone has PID. But I'm talking about real PIDs. I'm talking about sexually transmitted infections that were not well treated. Maybe you just have this foul smelling, bad vaginal discharge. Then you started having fever. Your body is hot. And then, and you go to the pharmacy and they just gave you some drugs and you are not well treated. Now, you can get better, but there could have been damages on the tube. It could have destroyed the inside of the tube. It could have blocked the inside of the tubes. So these are important things we need to know that can affect it. If you have a termination of pregnancy, for example, you went and terminated an unwanted pregnancy, and you are not well treated, you are not given antibiotics to take good care of it, it can lead to infection, and the infection can block your tubes. And these are one of the ways where you can have blocked tubes. So you must always guard yourself. You must always be careful. These are things that can affect it. Endometriosis also can affect tube. It can destroy the tube. If you have surgeries, mammectomy that got infected, that was not well taken care of, CS that got infected, all these things. Even if you have vaginal delivery and maybe you have retained product, or you have placenta retention, or even it may not even be placenta retention, you may just have infection after delivery. If these are not well taken care of, it can block the tubes. So these are very, very important things we need to note. These are the things that can cause difficulty with conception. Then if you have fibroids is neither here nor there. Fibroids itself alone, we can't say fibroid will cause infertility, or fibroid can affect your ability to conceive. But if we look at every other thing and we can't find it, we may have to look at that fibroid. And it also depends on the size of the fibroid. It is not the minute one that they will tell you that they saw fibroids. It's not all fibroids that need surgery. Then it depends, and the location of the fibroid is also important. There are some fibroids that are where they are located, they are blocking the tubes, or they are located in the cervix and they are not allowing sperm to be able to pass through. Some are even in the womb, that even if you get pregnant, it will be causing miscarriages. So these are important things that we also look at. There are something we call adenomyosis. Adenomyosis is a form of endometriosis, but instead of it being outside the womb, it's inside the womb, inside the body of the womb. So it will do the same damage it is doing outside it will do the same thing. Then if you have something, there are some things we call additions, uterine additions. It can also come from infection, pelvic inflammatory diseases, sexually transmitted infections. When you have this kind of infection and they were not well taken care of, and you develop some things like pus, you have people that are having one bad smelly discharge that were not well taken care of. You just find out that with little treatment everything stops, but it has damaged the inside of the womb. It has clogged the womb. It has glued it together. You just find out afterwards your menses reduced. Maybe before you are having you menstruate 3 times 3 days in your cycle, 3 days, and it flows well. You use about 3 or 4 pads per day, and suddenly you find out that you're only menstruating for 1 day, and one pad doesn't even soak. Then something must be going on. Or you had a termination of pregnancy that was not well taken care of after it was even taken care of, but the way the procedure was done had destroyed the inside of the womb, so that when healing took place, it glued the womb together. In such instances, that person, it is the same process. You just find that your menstrual flow reduced, the days that you are menstruating reduced after such a procedure, or maybe after myomectomy, or after cesarean section self. And when you resume your next menstruation, you just find that maybe you are menstruating, instead of 3 days, you are menstruating 1 day, and the flow is not much. These are important things that we need to keep in mind. So if you have some things like this, that means it is not something that you now be praying and it's good to pray. Fine, it's good to pray, but you pray and also take action. You don't just sit down at home and continue to pray. If you have all this that I've been saying, all this that I've been talking about, then that means that could be the reason why you're having difficulty with conception. And there are some times that we cannot even explain why you are having difficulty with conception. We have checked the man, we have checked the woman, we have checked everything. Everything looks fine. The woman is ovulating, everything is fine. Though sometimes in our environment we may not be able to do some minute tests, especially on the sperm, to check further if there are other issues with the sperm. But based on what we have done, we've checked everything, and you are still not getting pregnant. That is what we call an unexplained infertility. And all these things, they have ways by which we manage them. So what should you do if you have? I'm getting to the end of so I will soon round off. So what should you do when you are having difficulty with conception? One, I told you that if you have tried for 1 year and you are less than 35 years, afterwards you need to start getting concerned. If you are 35 years and above and you have tried for 6 months and you are not conceiving, you need to get concerned, and you need to start looking at where the problem is coming from. And like I said, sexual intercourse is the basis of conception. If you have not been having regular sexual intercourse, there is no way you are going to conceive. It is not a cause. It's not a cause. It is the process. The sperm has to get to where the eggs are, and there are timing by which the eggs are released. If you're having sex every other day apart from the days when you are releasing egg, we call it the fertile period or ovulation period. You can check, I talked about it on one of the videos in YouTube, how you can calculate your ovulation period. What are the things you need to, the days, if your days are not regular, then if your days are regular, how you will know your ovulation period, then how you should have sex around that time is on YouTube. It's free. There is another one that I talked about in total. That one is paid for. You get that one on the website. You go and pay for it and you download it, and you'll be able to watch it. That one I talked about different ways your ovulation, the different ways you can monitor ovulation. Then what are those things you need to look out for? Then when do you have sexual intercourse? When you see this, when you see that, that one you have to pay for it. There are other ones that are free. So you need to go and watch the video on YouTube. You'll be able to understand what to do, how you should have sexual intercourse. when you are trying to conceive. So sexual intercourse, I will always reiterate it. If you are not having regular sexual intercourse, the likelihood of you being able to conceive is low. Then after you have done this and you are sure you have had regular sexual intercourse, then you need to see a specialist. You need to. You don't sit down after a year that you have not been able to get pregnant, or after 6 months that you have not been able to get pregnant, and you wait. You don't. I've seen a couple that after about 4 years, that was when they now started getting concerned. After 4 years, and by that time the woman was already maybe 40 years. So as much as possible, once you have spent 1 year, if you are less than 35, and you have spent 6 months, if you are 35 years and above, and you are not conceiving, you should see a specialist as much as possible. Please go and see a specialist. It is very, very important. Then I talked about some lifestyle that you need to modify. There are some lifestyle changes you need to put in place. If you are smoking, you need to stop, either a woman or a man. If you are smoking and you are trying to conceive, you need to stop smoking. If you are taking alcohol, you need to stop drinking alcohol. Women, you need to stop taking herbal drugs. Even men, there's some herbal drugs, the herbs, especially unrefined herbs. There are some herbs that have been refined, that have been that various researches have been done, and they found out that okay, this is what this one is used for. These are the chemical compounds in it. You will see one herb that can be used for 10 diseases. It is not such herbs that you should be using, because that means there are a lot of things inside our herbs, and some of these herbs can even affect your ovulation. If you conceive, it can cause miscarriages. It can make your baby to have it can cause anomaly of the baby. The baby will just be malformed. That is why I always talk about taking herbs. I'm not against people that are selling herbs, but if you are trying to conceive, I always advise that when you are trying to conceive, as much as possible, you should reduce herbs intake. If you are taking drugs, cocaine, heroin, marijuana, and you are trying to conceive, you have to stop them. You can't continue to use all these drugs and you think you will get pregnant, or you get pregnant and you think your baby will not have issues. As much as possible, you have to stop taking all these things. It is very, very important. And if you are on the obese side, you need to lose weight. If you don't lose weight, it will affect your ovulation. If it is the man, it will affect your sperm. You need to lose weight if you are obese. And if you are underweight, it's not only for obese people. If you are underweight, you'll be having problem with your ovulation. People that are underweight don't ovulate. That's why you see that there are some athletes that you just find that they are not menstruating again. When they lose weight to a point, they will just stop, because there is a critical body weight that you must achieve before you start menstruating, before you start ovulating. So if your weight is low, that means you have to work on improving your weight. You have to gain weight. So it's not only those that are obese alone that you lose weight. If you are underweight, then you should gain weight. It's very, very important. So it's both ways. You have to have what we call an average weight gain, you have to have an average weight that is normal. These are very, very important things that you must do. Then you have to exercise. If you are a man, you exercise. If you are a woman, you have to exercise too, because exercise improves the blood flow in the body. It improves blood flow to organs. It improves blood flow generally. And when blood flows, oxygen gets to all these systems more. And when oxygen gets to them, they work optimally. So exercise has a way of improving, apart from the fact that it helps you to reduce weight, it has a way of improving your body systems generally. Then you need to eat well. You need to eat well. You need to take supplements. Take good supplements. Take vegetables, fruits, folic acid. These are important supplements that you must take when you are trying to conceive. and this will help you a lot. But as much as possible, when you find out that you are not conceiving, please, as much as possible, you need to see um, a fertility specialist. So you can send in your questions so that I can answer them. And before we round up, how can one boost ovulation? Like I said, um, I've mentioned all the things I've mentioned will boost ovulation. If you are obese, you need to reduce weight. If you are underweight, you need to improve weight. If you are able to get to that average weight, your ovulation gets better. People that are having polycystic ovarian syndrome, that are obese, if you lose as much as even 5 to 10% of your weight, a lot of times the menstrual cycle starts getting better and you start ovulating. These are important things that you need to do. You need to eat well, take supplements, take fruit, folic acid, vitamin B course. All these things are important when you are trying to conceive, and they will boost your ovulation. However, if there are medical issues, you need to make sure you see a specialist. Don't just stay with the general problem. You need to be evaluated, and you do a lot of tests. All these things I've listed, we look at them. We look at, okay, are you ovulating? Are your tubes normal? Is your womb fine? And all those things are important things that you need to put in place before you can say, okay, everything is going fine. What kind of exercise do you recommend for TTC? Well, brisk walking, jogging, anything that is not too excessive is good. For anything that is not too excessive. Men that are trying to that are trying to boost their sperm, they shouldn't go and be cycling, because cycling, they are sitting and they are cycling. Cycling will increase heat, and it will affect the sperm more. So not like cycling. Yoga and all those things can also improve and help. What can I do to prepare myself for IVF? They are basically the things I've said. As long as you have been reviewed and you have been seen that your womb, you don't have fibroids in your womb, there are no much problem with your womb, and everything generally is fine. Other things are the normal things that I've said, that I've talked about. I can't repeat everything again. The same thing I've said. As you are doing those things, then you take supplements. If you are obese and you are trying to do IVF, obesity, or even if you are underweight, can affect the success of your IVF. That is why it's important. If you are trying to go for IVF and you are obese, you must, as much as possible, try and lose that weight so that it can help you to improve your chances, your success, the success of your. Then you sleep well. Yeah, people are not sleeping. If you sleep well, sleep has a way of replenishing your body system. You sleep well. You sleep well. You can you if you it's not easy when you have to go to work every day of the week, but when you are on your off days, as much as possible, try and find a time out to rest and relax. Relax your mind, sleep very well, let your body be relaxed. This will go a long way in helping you. Can stress affect the number of days and quantity of blood flow when women menstruate? Yeah, stress. In fact, stress can make you not to see your menses. There are people that when they are planning, when they are preparing for exam, they just find out that their menses stops. They don't see their menses again. That kind of stress can make your menses to stop. It can affect your cycle. As much as possible, you have to find a way to reduce yourself from having stress, one stress or the other. Try and relax your mind, try and rest well. These are important things you need to do to help you out. Any more question? On Facebook, any more question? All right. So you can, if you need consultation, you can send a private message to me, either on Facebook or on Instagram. My consultation is not free, so that people, because a lot of people come in and I will tell them this is what you have to do, and they will say, oh, I thought it's free. It's not free. And if you want to see me physically, we can also arrange that. I'm in Lagos. We can arrange a way for us to see. So by and large, I hope you had a wonderful session. Sir, can MVA, manual vacuum aspiration, is that what you mean by MVA? This is the quantity of blood during menses. Manual vacuum aspiration, yeah, anything that you do, there is D&C, especially when you curate the uterus and you over curate it. Even MVA, if you over aspirate the uterus, it can take part of the endometrium, and when it removes part of the endometrium, then it will affect it can cause the additions that I talked about and affect your ability to have normal menses. So MVA can also cause it if it's not done well, depending on who that's why you don't just do anyhow. You don't just go and do such anywhere. You must do it with, you must allow somebody that has the understanding and the knowledge and the wherewithal to do all these procedures. Not just anybody that can do it. So I think you guys are, we can call it a day, Abby, or we can call it a night. Any more question? All right. So thank you all for coming. Till next time when we have this Instagram live again. Good night and bye bye.